the meaty bit. So,
because
yeah, thank you, Chet. So I just want to introduce Chet. Chester Durnas is an MD living in Chicago, and you've been gracious enough to attend lots of my presentations, and I know you've enjoyed the ones when I've been talking about navigating dementia with dignity, because this is your wheelhouse, Chet. Yeah,
there
and
is
you, yeah,
for the
and you have
past
a
40
lot.
years,
Oh my, how many years?
about 40. I
40 years.
started doing this about, let's say, graduated in 83, so since then, so long
Yeah,
time.
yeah, and you've got so much experience. And I was just sharing with Chester about my conversation I'd had with Don, which you will have all seen by now, regarding the being a nurse and anchoring in a post hypnotic suggestion. And so just tell us more about what you think to that, please, Chet.
Right. I mean, the problem with dementia is just think of it. You throw a rock in the river or lake and you see those ripples going away. That's your normal state. You're aware of every ripple there is. As the dementia progresses, those ripples shrink. So you become more or less to the area where you throw the rock. So you become more like yourself. Your personality, your social adjustments, and so on shrink. Being mammals, we respond to other emotions, their state of mind, their agitation, states like that. So you basically are pushing the nonverbal type of a communication versus, trying to explain this. Oh, this is what a beautiful day. Enjoy this thing. But if you take that person to the window, point outside and smile, hold their hand, it'll convey more about what you see and what you want to say than trying to describe the whole scenery and stuff like that. Because think of dementia as an ability to learn new information. It's
Okay.
a learning disability, basically. And you're losing your memories and stuff like that. So you have to every day wake up and become you. You got to remember who you are. You have to learn who you are.
Yes.
And depending on how much reserve you have no clue. You don't know who your mom is. You don't know your kids, daughters. You argue in the mirror. You argue with your pictures on the wall because they're not you. The person that you remember no longer exists. You might remember yourself as a 20-year-old, 30-year-old, and so on. And in your 60s, 70s, who's the hell on the wall? Who's the guy in the mirror looking at me? So, you can't, literally, I've seen people get in a fight with their mirrors because the
Okay.
person in the mirror is not the person you remember being you.
Yeah.
So, I keep telling you, if I get Alzheimer's, I'll be a pain in the ass and I'll need a lot of drugs. But
Yeah, okay. And you're right. If people, so what you're saying is that if their personality type is actually to be angry or to be frustrated and
Mhm.
not suffer fools gladly is a
Right.
very English saying, then it's like then they will be more irritable.
Correct. And the thing is there's some people, for instance, like to be alone, loners, and they're perfectly fine being alone. Except in today's society, we socialize and stuff like that. But as they become demented, they want to be left alone. And you have to understand that the friend circle will shrink. The people they trust shrinks. So a lot of people get upset that mama doesn't want to talk to you anymore. But she doesn't remember you the way you were. There's going to be what we call lucid intervals, where for hours, days, maybe they'll be perfectly okay. They say, "Wow, a
Mm.
miracle." But after once that goes through, they're back to their dementia or whatever baseline they have. So, and a lot of people take it personally. I mean, it's not them, it's the disease that does it. And I think the hardest thing is that, you got your mom, you got your wife, your kids, and they're taking it personally that there's something about them that they did that tricked that person off. No, there's, you know, a shadow on the wall, all of a sudden it sets off a paranoia and stuff like that. You misplace your uh, purse, jewels, whatever. I didn't forget where they were. Somebody must have stolen.
Oh yeah, yeah. That's what my
Uh,
grandma did a lot.
so, a lot of people will say, no, no, and, like I keep telling my kids, not to be crass, but, never argue with a fool because people may not be able to tell the difference.
Yeah.
And that's what happens when you start arguing with a person with the dementia. They're right, and you think you're right. And it's going to be like that Trump Zelensky conversation. They both were wrong. So, you know, compassion. And I'm saying when you walk in the room, and I keep telling my nurses, I'm a medical director for hospice. I keep telling the nurses it's a tough job. And before you go through that threshold, stop, take a deep breath, center yourself, and any luggage you have, leave it at the door.
Okay.
And then go in with an open heart, open mind, and whatever happens, happens. Don't bring any luggage with you. The best thing you can do is just go approach him at like a 45-degree angle, not face on, not from the back so that they'll get startled. Just slowly approach, have a little smile on your face, or not, depending on the person. If you deal with him, scowl's fine or smile's fine. Depends what they like. And that's up to you. When you center yourself, see what their mood is, and you try to match their mood. Just like in hypnosis, mirroring, matching, stuff like that. You match them. You become sort of in their world. You walk in, I speak dementia fluently. And that's my skill. Learn how to speak dementia
Yeah.
because you want to join their world. I mean, the world you exist in no longer exists for them.
Well, as what I see, I don't necessarily see people who are further down the road like you
Mhm.
do, Chet, but I see the caregivers. And what you're saying is absolutely really powerful, that they have to realize that it's not their loved one, it's the disease that may be
Exactly.
being
Even
sent to themselves.
early in the disease, there's a tendency for us, we all do it, whether we like it or not, is try to correct, fill in the gap.
Mm.
I mean, it's human nature. And yet, you know how you feel without dementia. If somebody says, you say something and they say, no, it's like this. I mean, it's not comfortable.
No,
Yeah.
yeah, yeah. Or if somebody
Why
tells
should-
you what you're thinking is
Yeah,
wrong, it's like,
yeah.
don't tell
Yeah.
me what I'm saying is
What
wrong.
I'm thinking is right for me. It might
Yeah,
be wrong for you, but it's right for me. And that's where the shift has to come through.
right.
Because whatever you believe, it's your belief. It's not their belief. I mean, you're not there to convert them to Christianity, Muslims, or whatever. You're there just to support them, make them happy. Let them enjoy the last couple years they have, last couple months, the best they can. You will not cure dementia. I mean, that's been tried for the past couple 100 years and it hasn't happened. But you can create an environment that's less stressful and decrease the progress of dementia, where you can slow it down enough that you enjoy a couple extra months, years, whatever, depending on the person. And
Yeah,
there's
that's what we're trying to do. So that is that when somebody gets their diagnoses, first of all, that they can actually live well with it instead of the fear being here.
right. And it's the biggest, and I keep telling my nurses the biggest thing when you get diagnosed with a so-called terminal disease or non-curable disease. The big thing is the emotional drain on the family and the person that has the disease.
Yeah.
Uh, Early in the diagnosis, majority of the patients still are aware that something's wrong. And when they find out they have dementia, they either give up or they fight or they just become ambivalent. And the big thing you see is a lot of emotional distress and depression. A lot of people will become depressed, you know, just cannot give up. And, then, go see a doctor, they'll give an antidepressant. And the big myth about antidepressants, they don't work. If you look at the antidepressant versus placebo, there's maybe 1%, 3% at the best difference. So, the thing is, you wipe your butt with a Charmin versus, whatever, same result. Antidepressants don't work. The best thing for depression, it's been proven, is either hypnosis, talk therapy is not that good, and exercise.
Yeah.
So if somebody starts getting depressed, take him outside, get him walk, get him interested in some kind of physical activity, where it's in the house, folding towels, doing the dishes and stuff like that. Make him feel useful.
Yeah. Giving them something to do so
Yeah.
that they feel as though they've achieved
Yeah,
something.
just don't flip on the news or CNN, whatever, and have them sit in front of the TV. And that's the worst thing, because the problem is, as the disease progresses, they will not be able to tell the difference between what's on TV and what's real.
Okay.
And a lot of times in nursing homes, I had to fight with the staff not to turn the news on, because it's very stressful. They see war on TV, crime on TV, and they internalize it. It's
Yeah.
not real. To them, it is. They think that's a window looking outside.
And it could be just literally
Yeah.
outside their front door.
And so they look at the war, bombings, stabbings, whatever. They can't tell the difference between TV and reality.
Right.
So the best thing you can do, cartoons are fine. The old 50s type of thing. And,
Yeah.
and a lot of times what we do is age appropriate stuff. So let's say my group will be hard rock and heavy metal, but the people they care of, they're still into the 50s bands and stuff like that. So you can make sure that whatever you're playing around is something they can remember. I
Yeah.
mean, somebody in their 80s will not listen to rap,
No.
or
No.
should not listen to rap.
And they won't be listening to Duran and
Yeah,
Wham. But by the time it's my time,
yeah,
the 80s will
yeah,
be being played.
yeah. I mean, and I got a Vida for me. I mean, come on.
Yeah.
um, so that's the point. The thing is, the best thing I can tell you, especially someone that is looking at hypnosis, stuff like that, when you start interacting with that person, stop before you go into the room or their house. Take a deep breath, or 5 of them, and then just kind of let it all out. Let the bullshit out that you have. Don't worry about the traffic. Forget about office and stuff like that, and just gonna be with them. And that's the hardest thing, is to just be with somebody just for them. I found out that, if I go in already blank mind anyway, so that's the way I am, I just hold their hand,
Yeah.
and just hold their hands and just look in their eyes and just kind of
Connect.
wait for them to do something. And they will either smile, go, okay. And you just kind of mirror.
Yeah.
And once you establish that little rapport, great things can happen. There's no behaviors. You can get them to eat. You can take them to the bathroom, change their clothes. You don't have to fight them, injure them, because the biggest thing in like a nursing home or care unit is bedtime.
Right.
The most injuries to the staff. Now think about it. Here you are, chilling out. There's some strange chick comes into your room, grabs you, strips you naked, tosses you in a cold shower. Would you like it? I wouldn't.
No. No. And
So
this has been my whole thing, Chet, that if people have been, this is why it's so important to me, and that's why I wanted to learn havening, was because if somebody first gets their diagnoses and they have, say, been abused when they were a child or a teenager or whatever age, then that needs to have been processed before they go down their journey of
Right.
dementia, simply because of that, because of people not being respectful and enough and going, hello, my name is, and starting from the top down.
Right.
Lots of towels, as you say, warm water, not a cold one. However, reality is that they're on a time. Get, and they've got to get everybody done, 20 of their patients washed and
5
clean.
o'clock, yeah.
And they start and say somebody's only just eaten, but they've got 20 people to do, and they do it boom, 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 because that's the job.
Exactly.
What and what do you, how do we get out of that one?
Well, the thing is, depending on the places I work with, it took a while to get to the point where I want to be. And now I'm no longer there. But, you start with a hand. I mean, you said you're having, but, the thing is, when you touch somebody's hand, it's very non-threatening.
Yeah.
And then you can go, you know,
Which is havening.
yeah. And then you can go to the head later. But, sometimes this is just enough.
Yeah.
And those people that have pets at home, you know how to do it. Any dog will behave. They want to behave.
Yeah, and it is literally havening. So I wonder actually if there's something that could be done here. If people in our field know about this, that actually they could do talks at care homes, even just half
Exactly.
an hour of with the people, and just training them, doing a quick talk. This is what you can do, and it will make your job so much easier, so much less aggressive. And that as you're saying it, you could be saying calm, calm, and that all of you are saying the same word. It could be safe, it could be calm, whatever it is, so that in the same tone, the same whatever, looking the person in the eye, smiling, making those people feel safe.
And a lot of the people that work there, they just don't come in to be mean. They just, they have a job to do. But you'll see how many of them, once you tell them, you do this, it'd be easier for you to change him, bait him, whatever, without all the fighting and fuss and stuff like that. And they'll listen to you. Same thing, you go to the administrator, you say, if they do this, this, and that, that will decrease your injury rate, absenteeism, stress, and stuff
Yeah,
like that.
yeah.
So you're looking at the administrator of a, let's say, facility, and they say, if you teach them this and how they do it right, they'll not only be more satisfied because they're doing something and you get a positive feedback from the patient instead of, getting pissed on, spit on, and stuff like that. And you work lighter, you don't have to, fight the person, and they're more cooperative. On the other hand, the administrator's happy because, you don't have injuries, you don't have workman's comp, you don't have days off because somebody injured their back or got scratched. They have to go to immediate care to get a bandage or whatever. So it saves money and it's good care.
Yes. And then you get good Google reviews.
Yeah.
Well, it's true,
Yeah. And you
and
get 4
actually,
stars from CMS, and that's even better.
yeah, but you go to bed with, your own self, look yourself in the mirror and go, I did a good work today.
Yeah. I
You
bring
know,
my giant dogs to the nursing home because I used to bring smaller dogs, but the big dogs are better because they're wheelchair size. 200
oh, yeah,
dogs is way better.
right.
And 2 mastiffs, and they can go. And you would think they'd be afraid of a big ass dog like that, but they're not. They're just kind of gently like grab him, and the mastiffs are very passive dogs, so they're just slobber in their lap. And I had a lady fell down, broke a hip. I was able to examine her while she was petting the dog.
Right. Yeah.
And that's painful,
Yeah.
but
She was distracted.
distracted. And that's the big thing. You give him something else more interesting to do, whatever that is, whether, hey, look, there's a balloon or whatever. You don't have to be anything major, something just enough to keep their attention for a minute. and he can get something done.
Yeah.
I suppose you got to do this or else, and it never works.
No,
I
no.
tried that with your 2-year-old.
Yeah. Well, yeah, exactly. And actually, I must admit, that's why we've got a golden retriever. And eventually, when he's a bit older, I will get him,
Yeah,
as a
actually, you should start now
he's gorgeous. Yeah. Okay.
because I had my Mastiff since they were like, well, I got them since the babies, but I started taking them when they were like 10 weeks, which
Okay.
is basically this big, which was like 10 pounds at that time. Now they're 200 pounds. So they grew up in there. So they're used to the wheelchairs. They're
Right.
used to people walking around. So they're a lot of dogs get hyper on the chairs and old people stuff like not my dogs. They grew up in a nursing home.
Right. Yeah. Yeah.
So if you have one like yours, just take him along.
Okay. Yeah. It's tell me more. What do you think about that? That when somebody, because you are a hypnotist as well, Chet. So when somebody has their first diagnoses and then they are divulging that they have some, you've seen my
Yeah,
presentation,
amygdala.
but yeah, some poo on the amygdala. So to release. What do you actually think about that as being a good idea to release that, get rid of it, process it now while they are still in
Yeah,
say
I mean
stage
the
3, 4?
right. I mean the biggest thing, you have anxiety, depression, stuff like that. But the biggest thing, the first thing, one of the first symptoms in dementia, especially Alzheimer's, is a sleep disturbance and mood disturbance.
Mm,
Alzheimer's starts at something called locus coeruleus, which is the blue focus point, but that controls your sleep. So it's the one of the first thing. So it's been shown people, especially women, if they don't sleep enough, they're more likely to develop Alzheimer's or not. Something you might want to remember. Get some sleep.
yeah.
And if you teach, just basic relaxation, doesn't have to be anything. It could be progressive relaxation. You can, take him. My thing is, take him on like a nice trip. He says, was there a place that you like to go and stuff like that? And and you just get a couple hints. So, okay, close your eyes. Now take a deep breath and think. That little meadow that you were as a girl, you can see the flowers, you can smell the flowers, you see the sun, you feel the warmth on your skin. That's right. Take another deep breath. It's not complex trip, but 10, 15 minutes, they're zoned out. You can leave them laying in bed and come back later, they're still sleeping. And that gives them to rest, decreases agitation, and so on. It will help with the depression as well. If you relax, it takes the stress out and stuff like that. Golden.
Yeah, no, I agree. And as Dr. Daniel Nightingale, because you know who that was, who I trained with, he proved that when people are in that, they're getting their eyes are going left and right. They're getting the hypnagogic bit
Right.
of hypnosis. And actually, when that happens, they get the shot of acetylcholine,
Mhm.
which is good for the brain synapses when
And
they're
it
in
puts their
hypnosis.
memory temporarily. Yeah.
Yeah. So because if they've got Alzheimer's, because as you say, that's mostly when they get sleep deprived, they're not getting that. They're not getting that acetylcholine. So therefore it
And-
does help.
right. And and the thing is there's sleep disturbance and then you lose your REM cycles and stuff like that. So that will increase chances for paranoia, hallucinations, stuff like that, which a lot of those individuals get.
Yeah. Yeah.
Because they're sleep deprived and plus their connection to the what we call reality is tenuous. So you have two things going against you. You can't make sense of the world, and then you're getting paranoid, hallucinating because you sleep deprived. So you're solving several problems at once.
Yeah. Yeah. With the sundowners,
Yeah.
it can be quite scary for them with the shadows and things like that.
Right. And I keep telling people, if somebody has sundowners, don't go for psychotropic, leave some lights on, so it's not as dark and sensory deprived. You know, what happens at night, you know, during the day, let's say whether it's a facility, home, there's hustle and bustle, noises, light and stuff like that. At night, all that gets cut off. All your senses get cut off. So it's quiet, it's dark, and you're left alone. And you don't understand the world, and any little thing, a little noise and stuff like that. What is that? You know, is it a monster in the bed or whatever? You know, then there's a flash of light here and there. You know, in today's society, we get, you know, alarms, your Roomba's blinking, you know, your fire alarms blinking. So all these stimuli are just overwhelming.
Yeah.
So that's what I'm saying. If somebody has dementia and they're prone to have sundowning, leave this some stimulation on where it's a sound machine, couple night lights, so it's not totally dark, and so on. So that will cut down on it a lot because you know using psychotropics or medications like that has been shown that they will increase your chances of strokes, heart attacks, and stuff like that. So I mean, it'll solve the problem. It'll kill you earlier, but
I
that's
know.
not what we're going for it.
I had a I did. I very sadly had a client. The family got me involved. I couldn't help her. She scored 0 out of 30 on the MOCA scale. There was, and she was on so many psych meds because she was, and it was, there was no Medicaid. It was all they could. It was, and it broke my heart because there was no support because of the medical situation here in America. It was like they just didn't have the money, and she died within 6 months. I mean,
Yeah,
literally. I was supporting him more than anything, and I would go. The children were paying for me to go, and I only visited about 4 times, but I couldn't do anything for her. But I could massage her hands, and
yeah,
I could file her nails. I couldn't paint them because she would get up and down all the time too much. But her tummy was hurting all the time, and I expect it was probably the medication. She stopped eating, and she literally just it
hmm
withered away. And she was 58 years old.
yeah. That's unfortunate. Most likely genetically based dementia.
She had they thought it was alcoholic dementia. She'd been
Oh,
alcoholic,
okay. Well, yeah,
and that'll do it,
it
won't it?
bypasses the genes. Yeah.
That bite, yeah. I mean, this is like people don't always understand just how bad the amount of, when people are alcoholics,
Oh, yeah.
they don't
And it's
realize.
not that uncommon. It's usually early enough, and a lot of people will get it. The problem with alcoholic dementia, they tend to be more agitated and violent as opposed to people with, let's say, frontotemporal or Alzheimer's or Lewy body, that kind of stuff.
And she was, and that was why she was on the psych meds.
Yeah. But, the thing is, depending, not all psych meds are created equal. Somebody with alcoholic dementia might just do okay on a tranquilizer, like Valium, Klonopin, that kind of stuff, because that's what alcohol does to your brain. So you're just going to replace that. I mean, yes, they might have withdrawal symptoms, they might have hallucinations, but not all hallucinations are bad. I usually ask them,
Oh,
they see babies. I said, okay, does it bother you? No, fine, enjoy them. I mean, you don't have to treat it. If it does not disturb what they're doing, go for it. I mean, you have some friends in your room.
yeah, yeah, this is true. And some people actually, before they die, they start seeing people
Oh,
because their other family are there. I mean, you must have come. You're in the hospice.
that's actually quite normal. And there is a book from England, actually. It's called Art of Dying.
Mhm.
And he goes into it. It's a couple, actually. Both are researchers in that area. And it's very common for people that are dying to see couple hours or couple days their relatives or people that passed on and so on, and have quite normal conversations. And those people that do that, they actually have good deaths.
Yeah, yeah. And it's interesting because I think that's important for people in the hospices as well to say, yes, they are there, instead of saying, no, there's no one there. Because then you're not in somebody's reality. To them, they are there. And do you know
I
what?
mean,
They probably,
we only see a certain amount of spectrum, we don't see
oh,
from 0 angstroms to 10,000 angstroms, just see a little narrow band. So maybe their vision and appreciation of other realities. I
I
mean,
know.
I'm not saying there's no ghosts, or there are. I mean, I haven't seen one. And when I do, it'll be too late, right?
Well, we don't know. So I find it's all fascinating, but I think that's the most important thing, is to be in somebody's reality
Right.
and agree with them. I went to another lady's house and she was having hallucinations, and I wasn't allowed to sit on the sofa because I would be sitting on people.
Hmm.
Because she had loads of guests there. So they had to bring out another chair for me to sit
Yeah.
on. And because I didn't want to, and then she goes, there's somebody else there. She goes, they've just taken their eyeball out. Anyway, and I was like going, okay. And I said, and I did know that she had been a caregiver. And so I said, you're doing a great, you're caring for all these people. And we just went out, and what's their problem? And there was somebody was an amputee and somebody was this. And she goes, they're really bothering me now. And I said, shall we ask them to leave? And so, would you like that? Yes. And I said, okay. So we opened the door and I said, can we ask them to go now? That was what we did. And that's exactly what we do with children.
Yeah.
Imaginary play.
Right. And the thing is, with kids, we sort of kind of encourage it. Well, not anymore these days, but
We
like when
used
I
to.
was a kid, we used to, so fine, enjoy it, because it stimulates the imagination, stimulates learning and stuff like that. And who's to say that, their hallucinations aren't serving or explaining part of the world that they don't understand? Just because they, parts therapy, you have a executive part and stuff like that. So, there's one part that's has amputee and tells you what to do. It's quite normal as far as I'm concerned. I mean, they don't need to be treated for it unless it's disturbing and it influences quality of life or makes it worse. So, at first people were looking at me like, what the hell, dude? They got hallucination, got to treat it. No, they're not being bothered by him. They enjoy him. Let him have it.
Yeah. And the hardest thing was for me, because her son was going, but they're not there. No, they're not there. He was shouting at me, go, they're not there. And I'm like going, they are to her.
Yeah.
I said, and it's like, and he goes, but I keep telling her there's no one there. And she keeps arguing with me. And I'm going, because they are to her.
Right.
I said, please, and I had to have this big conversation with him that please stay in her reality.
Right.
And all you have to do is just, if they get too much, then just ask them to leave. And then it goes, but you don't understand. She asks me to go shopping and I've got to buy them cookies and I've got to buy and there's no one there. And I'm like, okay.
Well, just, buy him some junk food. Don't have to buy enough for a month, but, a bag of cookies. I mean, they're going to disappear sooner or later.
But you can understand how people, the caregivers
Yeah.
get so frustrated. He goes, but I'm hearing this all the time. I'm like, I know.
Yeah.
I'm going to argue with them though.
And the way I used to approach that kind of stuff, like somebody, says, well, where's someone? Oh, yeah, they had to go to work.
Hmm?
And that solves a problem for a few minutes. They come back. Oh, they had to go to work.
Yeah.
The beauty about dementia is you can hide your own Easter eggs,
Or you can it could be Christmas every day.
Yeah.
Wrap up presents if they like opening them, or get them to wrap some up or whatever.
Yeah, exactly. I mean, the thing is, a lot of people want to help, so we have them fold towels.
Yeah, or pair socks.
Yeah.
And then unpair them again. Here you go.
Yeah.
Pair them again.
And it's a never-ending story there. This same towels gets folded 50,000 times. Who cares? But it gets them occupied, gets them out of their heads, and
And then motor
yeah,
fingers, because again, because we want to keep them dressing themselves for as long
right.
as we can.
And I'm a firm believer that, the thing is, you have the Eastern philosophy, you got the Western philosophy, one's into the physical, one's into the mental. They're both wrong. It's one. It's mental and physical in one organism. So if your body functions, your mind will function better, and vice versa.
Yeah.
Like that in what's it, corporis man or whatever, that Latin term, healthy body, healthy mind, and vice versa. So
It's
as
true.
long as they're physically active, their mind will engage and continue to function and deteriorate slower, because you need your mind to operate your muscles and stuff like that, coordinate and stuff like that. So it kind of preserves certain pathways and helps them persist longer, as opposed to if you just put somebody in a wheelchair, you're going to see how fast they're going to decline. It's just going to wilt in front of your eyes.
Yeah. Or put the TV on
Yeah, that's
and
even worse. That's like melt your brain.
yeah. So keeping people as active and outside the fresh air and
Oh,
just
yeah.
family and engaging for as long as
I,
possible.
I mean, even if they don't walk, if they're in a chair or have a walker, just take them for a, short walk.
Mm.
Fresh air, the sun, the wind. At least it'll get them out of the piss smell in the house.
Yeah, yeah. And that's another thing that can be very hard for the caregivers.
Yeah,
Uh,
the incontinence, yeah.
because the incontinence and then they, it's like, yeah, how do you have those conversations? And
Yeah.
it's hard, it is a horrible, heartbreaking
Right. And
disease.
and the other thing is, we're talking about the person with dementia, but I think the other problems that a lot of people tend to neglect is the caregiver.
Yeah, that's one of the reasons why we're doing this, is to help the
I mean,
caregivers.
giving them hints and ideas on how they can perform better so they don't get burned out.
Oh yeah, yeah,
Because I keep telling people, if you burn out, who's going to take care of your mom or your whatever? So you want to make sure that their staying is healthy, to get some respite, take a break, go to a movie, go shopping, get a mini petty, whatever.
yeah,
Something that's not taken care of, something that gives them a break for a half hour, an hour. So that's where, and it's for some people it's tough because, getting somebody come to your house is like what, 20, $30 an hour. And not too many people, have the means to afford it. But there's volunteers and so on. We have a couple, like a what do you call, bright side, where you can take somebody with dementia, and it's sort of like a kindergarten, where they have activities for people with dementia. They paint, cut out, whatever.
yeah.
Don't take me there because I'm not going to be one of those guys painting and cutting out stuff. But
Well, we'll take you to a place where there's lots of dogs.
yeah,
Would that do
North
it?
Park, yeah, that'd be perfect. But that is what I'm saying. And there are resources in the community if you look for it, and those are inexpensive. They're subsidized many times. So uh, it would be nice if you deal with a lot of, like you do, see if there's something around your place, that provides those kind of services as well. So you can always, say, yeah, have you tried that or whatever. And the other thing is, people know someone that has the similar situations, and just getting together, commiserating over coffee, tea, wine, whatever, and sharing stories, kind of unburdens the caregiver a lot.
Yeah, support groups.
Yeah, because they know they're not alone.
Yeah,
They say, I did this, I did that, and they'll pick up a hint or two as well.
yeah. I've got one client, she set up her own support group,
Yeah,
and she then shares a lot of what I say to her
right.
because
And it's great. I mean, the thing is, this is not copyrighted. They can put on,
oh no, it's like, yeah, this is to help. I mean,
and
it's
and
absolutely.
we have one goal and thing: you just make everybody's life better.
I agree. I agree. And yeah, make that happen as soon as we can. So tell me more about, you know, you work in the hospice, and what else do you do? Chet?
Right now, since I got retired, I still go to nursing homes,
Okay.
visit my old patients and stuff like that. I'll take my dogs with me, especially in the winter. They're great. It's 400 pounds of dog in the back of my truck. I get good traction. But I'll take him with me and, go visit residents and stuff like that. And I do teach nurses on care, the best practice. I mean, got time and I can spend time. Says, if you did this, it'd be way better. If you center yourself, you're gonna have better mental health yourself. You can go home and you won't beat up on your kids and kick your dog, that kind of stuff. So, so mainly it's teaching and showing what I think are the best practices. I could be wrong. I could be, whatever, but it works for me.
Yeah, and well, it sounds wonderful. So I really appreciate you coming on and sharing your wisdom with us, because it really does help. Do you know, there was something that we don't necessarily know much about, for us as brain health coaches, is the the drugs. And I always get, because we don't deal with those, of course, we don't treat, diagnose, or anything like that. However, it's and we work alongside the doctors
Mhm.
to to but sometimes, do they get it a little bit wrong? Do they get the diagnoses? Does a neurologist get this diagnoses wrong? And
Well, the thing is, I mean, I'm a geriatrician by training, so I have a certification in internal medicine and geriatric
okay,
on top of
okay.
it. So when I started out, we had psychiatrists and neurologists doing dementia. Nah, some of them are okay at it, but remember the old saying, if only tool you have a hammer, everything looks like a nail.
Okay, they just give the set. Okay.
So the psychiatrists tend to go more heavy on the psychotropic drugs, neurologists go into neurological drugs. So you have seizure meds, you'll have for behaviors, uh, uh, Aricept, Cognex, those medications. But I was involved in the early studies on drugs like Aricept.
Mm-hmm.
At that time was Cognex, which no longer exists because it'll melt your liver. But that was one of the first.
Right. Okay. You see, so they were all guinea pigs. I mean, this
Yeah,
is what's so. What about Donipezil, or is that
yeah,
Aricept?
it's Aricept, yeah.
That's the same one.
But
Okay.
that's the son of Cognex, uh, and Cognex was not intended originally for that, but it noticed that some people improve their memory, which basically builds up your acetylcholine in your brain,
Okay.
which is involved in memory. Unfortunately, it had side effects, which, not liver friendly, let's put it this way. So a lot of people couldn't tolerate nausea, vomiting, liver issues, elevated enzymes, and stuff like that. Um, Out of hundreds of people that I studied, I think there's like two that actually showed excellent results. Rest of them, same thing with Aricept. If you do Oxford scale, which nobody gets 100% on, there's a statistical change and difference. However, is it significant clinically? In most cases, it's not. At best, the donazepam or Aricept or rivastigmine and all the other ones might buy you 6 to 8 months uh, of kind of mediocre achievement in early stages. And, they got it pushed out to late stages, which I don't know how you can tell a difference, but that's me. I'm not smart enough. But the only thing that they noticed was the delayed placement in a nursing home. Then
Okay.
that for
Delayed
depression.
replacement. Mhm.
But when we were doing the Cognex studies, which the drug was dangerous, I mean, theoretically, sort of like experiments. Uh, Notice that those people also did better that way. It's because of the extra attention when they were in the study. So people would check on him, do the blood test, do the test, paid more attention to that person, see if there are any changes, stuff like that. And I think that part was actually responsible for the positive results as opposed to the drug itself.
Oh.
The attention, the
There you
care.
go. Because they were so interested in what their results were, they gave more, as you say, more attention.
They were paying attention to the person. And that's what matters.
Oh.
When I was in my fellowship, skin ulcers are a big issue, bed sores and stuff like that. And one of my mentors was from Ireland, and he says, for the best results, you need a new study every 6 months. Because, the protocol changes, people start paying attention, changing dressing and time, stuff like that. Same principle. It's not the
More hands-on.
intervention, it's the paying attention to the problem.
Yeah, to the
And
person.
to the person. And that's what I think, okay, if you pay attention to the person with dementia, just like having a baby. If, says my kid got potty trained at such and such a. No, you got potty trained. You started looking for the signals, what's going to happen when the kid's going to soil their diaper. Same thing with person with dementia. You started picking up on the nonverbal clues, what they're going to need, and you anticipate it and you address those clues before they become a problem. What happens is if somebody starts getting agitated, they don't go from 0 to 100 in a second. There's little fidgety stuff like that happens. And if you're paying attention to that, you can intervene before it gets catastrophic. You want to stop it here, not there. And that's what happens with those studies. I think it's a observer bias versus actual result.
I think that's so fascinating. Yeah, well, I really do.
So, that's what I'm saying.
That.
Leave yourself at the door, pay attention to what you're doing, and you do way better.
Yeah. Yeah, absolutely. There you go. And it's all about attention, making the person feel heard, that they bringing the person back, which is what that's what when I draw those diagrams, you've seen me and you've said yes, make the person big again, and then the depression, the fear, the anxiety gets small, and bring back the personhood.
Yeah, make them the focus of your attention, because if you're there with another agenda, what you're looking at is not your focus.
Yeah.
I mean, how can you pay attention to someone while you're distracted with this or that? And people do sense that, especially people with dementia. They're more primitive, let's say, in their emotion, their raw emotions. They'll sense the raw emotion.
Yeah, it'd be like, what about me?
Yeah. They'll know that you're ignoring them or whatever. They know that you're not involved. And all of us do that, but since we're too polite to mention it or too busy not noticing, while somebody doesn't have the distractions, they will notice.
No, I think that's very, very helpful. I've got a client, he got diagnosed 10 years ago with prefrontal lobe. Well, he's still alive, and it's not prefrontal lobe, because that would have gone, he would have been dead by now, I'm sure. And he did used to be an alcoholic. So we don't know if it's that, but they don't know which, it's not Alzheimer's. He's had a scan. He's not coming up with those. They don't know which dementia it is, because of course there's 100 different types.
Yeah.
So it's very confusing. They don't know what they're dealing with.
Right. In the frontal lobe, it's usually, changes in personality and stuff like that. Occasionally with problems with walking, stuff like that. And it can be, alcohol, it could be heavy metals, toxins, industrial toxins, or whatever, TBI, traumatic brain injury, stuff like that. So you don't know. And once you remove the noxious stimuli, it doesn't progress. It just stops. It's just like a multi-infarct dementia. You have a stroke, you lose your cognitive ability, and you don't have another stroke, you're at that stage and you're going to be like that. So it will not progress.
So he could just stay like, I mean, he has changed a little bit, but not that much. So you
Right.
could just stay where he's at until
Correct.
he dies of something else.
Yeah. Get
Pneumonia
hit
or
by a
something.
bus. Yeah.
Okay, so it doesn't always
No,
progress down.
it, depends. If you have something happens to you, you get insult to your brain,
Mhm.
brain heals, recovers, whatever, and there's no more insult again to it. So no more strokes, circulation's fine, blood pressure's fine. They can be like that. There might have some changes because normal brain aging and stuff like that.
Or mobility because
Yeah,
of 84 or whatever.
right. But there's no reason for him to get worse.
Right.
And that's kind of nice and not so nice because you have it and you won't get better, but you won't get worse either. So you're stuck.
Yeah. Okay. Okay. Interesting.
And
Okay.
that's what a lot of times which is the second most common dementia in this country is multi-infarct dementia, which is a lot of people who have mini strokes and stuff like
Yeah, the
that.
vascular
Yeah,
dementia.
vascular dementia. So it goes like this. You have a stroke, you drop, and you stay there till your next stroke, and you drop again, and then stay like that. And
Right.
that's assuming you have more strokes in the same area. And you have to lose about 50 cc's of brain volume for that kind of stuff. So it's not a baby stroke. We're talking a decent stroke.
Yeah. And that's why looking after ourselves is so important.
Right. I mean, the thing is for you guys, omega-3s and vitamin A is important. If your omega-3s are low, all the vitamins won't help you. So, if you have a nice fishy meal once in a while, or if you like Norwegian, probably cut liver oil. And, vitamin B complex will kind of preserve your cognition for a little bit longer. It's a thing that works. Melatonin, there's a lot of people there. You might see some on YouTube. They're talking about big ass doses of melatonin. Melatonin actually is used in your brain as an anti-inflammatory and regenerative type of substance, but your brain secretes in nanograms. And the people that use it for sleep is like 5 milligrams. Basically, it does not get into your noggin. Stays on the outside. So, a lot of people, if you take a gram, you might get a higher dose because just sheer brute force, but would not recommend that.
I have mushroom coffee.
Yeah, why not?
Good. Apparently that's good for you as well. But okay, yeah. So vitamin B complex or B12.
But yeah, complex is better. Has everything in it. B12 has been associated for a long time with cognitive function. And we're talking about pernicious anemia, which has been more common way back than it is now. And it can cause nerve damage. So you basically affects your proprioception. So you don't know your fingers up or down, your vibration sense is impaired if you're deficient. In most people, you have like 5 years worth of backup in your liver. And it takes a while to become deficient. But if you take 1,000 milligrams a day, that should be more than enough.
Right. Yeah.
Unless you totally lack intrinsic factor, then you have to get nice red shots.
Yeah, because they do give great big shots of B12, don't they?
Yeah, but it's usually people think it's for weight loss. I don't know how that's going.
Oh,
If you get those weight loss clinics, everybody gets. I think it's a placebo effect. It's great. You get this purple, this bright red stuff in your vein. Oh, it'll cure anything.
there you go. Or you can pretend you have in hypnosis.
Yeah. Well, that's better. Get a gastric band.
Real or imagined, it doesn't matter. So, okay. No, thank you so much for talking to us today. Thank you, Chet. I'm going to stop the recording now and let you get on with your day. Because
if anything specific you want to know, just let me know ahead of time. I might get my old and stuff like that. I mean, I don't mind helping out at all.
Okay, well, that's very kind. Thank you.
And since we're working on